Antifungal agent, chapter 17. Antifungal agent. Antifungal agent. There has been an increase in the incidence and severity of fungal infection in man and animal in recent years. Several unusual and drug-resistant organisms have emerged. This may be consequent to the use of broad-spectrum antibiotic and anti-cancer drug, which impair host defense mechanism. Fungi are eukaryotic with membrane-bound organelles and have common cellular characteristics with mammalian cell. Hence, it is difficult to target the fungus, especially without host toxicity. In vitro antifungal susceptibility testing differ from that of bacteria because fungi may be in the form of yeast or filamentous fungi. Yeast, Candida, Cryptococcus neoformans, Melassagia, filaments, Aspergillus fusarium, Rhizopus, Microsporium, Trichophyton, mycelial form, Sporothrix, dimorphic fungi, blastomyces, coccidiosis, histoplasma. Antifungal drugs kill or inhibit the growth of fungus in the body of the host and are used for superficial and deep systemic mycosis. Some fungal infections are self-limiting, get cut without treatment. During resistance, drug resistance, inherent or acquired mutation decrease the uptake of drug. Efflux reduce affinity of target enzyme. Combination reduce the resistance. Clinically, fungal infection in man and animal can be classified into two groups. Superficial fungal infection. Superficial fungal infection include dermatophytes of the skin, hair, and nail caused by Trichophyton, Microsporum epidermophyton species, and candidiasis or moniliasis of the moist skin and mucous membrane, GIT, and genital tract. Systemic deep mycosis. Systemic fungal infection, coccidioidomycosis, histoplasmosis, cryptococcosis, candidiasis, or blastomycosis, etc. The yeast or opportunistic pathogens also invade the external auditory canal and cornea. Systemic infections are life-threatening like A. Aspergillosis, broader pneumonia, and mycotic abortion B. Blastomycosis lung C. Histoplasmosis invade macrophages of host and disseminate to lungs D. Cryptococcosis granuloma of alveoli and urinary tract. Antifungal chemotherapy. Antifungal chemotherapy. Antifungal drug may act on cell wall, echinocandins, casfofungin, pneumocandins, cell membrane, pollines, amphotericin B, nystatin, natamycin, azole, imidazole, ketoconazole, miconazole, nilconazole, clotrimazole, triazole, fluconazole, itraconazole, voriconazole, allylamines, terbinafine, naphtidine, nucleic acid synthesis 5 flucytosine, greaseofulvin. Other greaseofulvin greater than inhibit mitosis inferior with polymerization of microtubules and disorganize the spindle formation. Classification of antifungal agent. Classification of antifungal agent based on chemical nature. Antifungal antibiotic, polyene antibiotic, amphotericin B, nystatin, hamacin, natamycin, other greaseofulvin, antimetabolites, flucytosine 5-FC, azoles, imidazole, clotrimazole, iconazole, miconazole, ketoconazole, butaconazole, oxyconazole, sulconazole, sertaconazole, isozonazole, trizole, fluconazole, itraconazole, turconazole, voriconazole, posaconazole, reviconazole, miscellaneous, terbinafine, echinocandins, caspofungin, micafungins, anindulf, and anidulafungins. Other topical agent: tolnaflate, undecylenic acid, benzoic acid, salicylic acid, naphtidine, selenium sulfide, cyclopyroxolamine. Antifungal agent can be classified into two groups based on their mode of application. Systemic agent used in treatment of fungal infection of internal organ or GIT. Some of these may also be useful in treating dermatomycosis via blood and enter keratin producing cell in the skin. Topical agent used for treatment of superficial fungal infections, usually applied topically. Griseofulvin is used to treat dermatomycosis, but administered orally after absorption it enter in the keratin producing cell in the skin via circulation. A topical agent used for dermatophytosis should have both fungistatic and keratolytic properties. Otherwise, it should be combined with a keratolytic agent so that it can remove the keratin layer and facilitate the surface content of the drug and the fungus. Systemic antifungal agent. Systemic antifungal agent. Polyene antifungal antibiotic. Amphotericin B. Nystatin, natamycin, pymericin. Amphotericin B obtained from a strain of Streptomyces nodosus, active against wide range of fungi. Principal drug to be used against deep state systemic mycotic infections despite its toxicity. Chemistry: it is an amphoteric polyene macrolides, poorly soluble in water and unstable at 30 degrees Celsius. Antifungal activity is maximal between pH 6 to 7.5 and decrease at low pH. Amphotericin B sodium deoxycholate compound with phosphate buffer is more water soluble. Lipid formulation or liposomal drug are less toxic costly. MOA MOA bind to ergosterol, the principal sterol of fungal cell membrane, form pore and causes leakage of cell counter H plus influx and K plus efflux. Internal acidification, fungicidal effect. The sugar, amino acid, and other water soluble substance leak out of the cell. Amphotericin B also act as immunostimulant in animal. Bacteria do not have sterols in their cell membrane and are insensitive to pollens. Cholesterol present in the mammalian cell membrane resemble to ergosterol and pollens bind to it as well, though with lesser affinity. Therefore, selectivity of pollens in low and amphotericin B is one of the most toxic, nephrotoxic, and anaphylactic systemically used antifungal antibiotic, but it is the least toxic among pollens. Amphotericin B increase the antifungal action of flucytosine, and their combination is the drug of choice in cryptococcal infection, meningitis. Spectrum Spectrum Broad spectrum antifungal antibiotic, fungicidal, active against blastomycosis, histoplasmosis, coccidioidomycosis, candidiasis, cryptococcosis, and sporotrichosis. Not effective against ringworm. PK PK. It is not absorbed on oral administration, hence administered as IV infusion in form of colloid suspension. The half-life is more than 20 hours, bind to plasma protein and cellular lipoprotein and release slowly from this site. Only a small portion is excreted in urine. Penetration into CSF is poor. Absorption from lungs following aerosol administration, hence useful in pulmonary aspergillosis. Lipid-based formulations have been developed to reduce toxicity. Interaction of amphotericin B with mammalian cell reduce toxicity. Lipid complex concentrate in lung tissue, fungal pneumonia. Drug interaction. Drug interaction combined with other drug for synergistic effect and reduce the toxicity with flucytosine additive synergistic in Candida streptococcus infection. Reduce the dose of amphotericin B and reduces the nephrotoxicity in human use for cryptococcal meningitis with azoles theoretically antagonism. Candidiasis fluconazole plus amphotericin better than monotherapy. Systemic mycosis in dogs can be administered with ketoconazole. Toxicity: renal toxicity, acute tubular necrosis, neurotoxicity, and abnormal liver function. Thrombo thrombophlebitis at injection site, hypokalemia, cardiac arrhythmia, nausea, malaise, and depression. In dog and cat, nephrotoxicity develops within 3-4 weeks of stringing treatment. BUN and creatinine should be monitored to know the extent of renal damage. Lipid based formulations are less toxic. Administration. Two basic regimens have been suggested for treatment of systemic mycosis in dogs. First regimen for healthy dog, 0.5 mg per kg IV every 48 hours with BUN monitoring. On the first day, the total dose is diluted in 20 ml of 5% dextrose and 5 ml is given. If no anaphylactic reaction is observed within a minute, the remainder is given over 45 seconds. Thereafter, the total dose is given over 1 minute in 20 ml of 5% dextrose. Continue for 6 to 12 weeks. If BUN exceeds 60 mg per DL, dose is discontinued or reduces 25 to 50% of total dose until BUN falls below 40 mg per DL. Slow IV infusion in 1 liter of 5% dextrose over 5 hours less renal damage. Second regimen in debilitated animal and initial dosage is 0.2 mg per kg IV increasing by 0.1 mg per kg daily until day 4, 0.5 mg per kg. Then use the maintenance dose 0.25 mg per kg every other day. Application: in spite of toxicity, it is the drug of choice for systemic mycosis caused by dimorphic fungi in immune-compromised hosts. In non-compromised hosts, the less toxic ketoconazole and nitrazole are preferred though they are fungistatic hosts. Localized cutaneous phycomycosis for 6 weeks. Pulmonary cryptococcosis 0.5 mg per kg infusion for a month. Not suitable for local application in mycotic keratitis. Nystatin obtained from Streptomyces norsei. Its antifungal action and other properties are similar to amphotericin B but become of higher systemic toxicity. Its usefulness is limited to treatment of candida infections of the skin, mucous membrane and GI tract and applied orally or topically, not absorbed orally. Drug of choice for prevention and treatment of intestinal moniliasis. Natamycin. Source S. natalensis.
effective against a wide range of filamentous and dimorphic fungi and yeast. Used for local application against ringworm in the other for mastitis and on eye for mycotic keratitis. Not effective against deep mycotic infections of eye because of poor penetration. Candida mastitis 20 ml of 2.5% solution or 10 ml of 5% solution. Memory of ID for 3 days. Horses filamentous fungal keratitis on drop of 5% suspension every 1 or 2 hours, decreasing to 6 or 8 times daily after a few days. Can be used nasal aspergillosis in horse, toxic by oral route. Azoles. Azoles. The clinically important members are imidazole, topical clotrimazole, iconazole, and miconazole, systemic ketoconazole, and thiabendazole, triazole, systemic fluconazole, and itraconazole. The older antifungal need to be given intravenously and are quite toxic. Azole are never synthetic antifungal that are effective orally and are less toxic. Imidazole and triazole have broad-spectrum fungistatic activity, covering dermatophytes, candida, and some are also effective against systemic mycosis. They inhibit fungal cytochrome P45, P45, 450 enzyme lanocyne 14 alpha dimethylase, which converts lanosterol to ergosterol, the main sterol in the fungal cell membrane. The interference in ergosterol synthesis lead to structure and functional enzymatic abnormality in the fungal cell membrane. Triazoles are less toxic than imidazoles because of their lower affinity for mammalian cytochrome P450 and causes less interference with mammalian sterol synthesis. Ketoconazole (KTZ). Ketoconazole (KTZ). First orally effective broad-spectrum antifungal drug, useful in both dermatophytosis and deep or systemic mycosis, effective in treatment of dermatophytosis, alternative to griseofulvin, and also very effective in histoplasmosis, blastomycosis, coccidiomycosis, cryptococcosis, and mucocutaneous candidiasis. Less potent but less toxic than amphotericin B. After oral administration, gastric acidic facilitated absorption. Ketoconazole causes microsomal enzyme inhibition and thus metabolism of many drugs. Also inhibit steroidogenesis. Toxicity and adverse effect. Toxicity and adverse effect causes GI disturbance, nausea, vomiting, dizziness, itching, increase in liver enzyme, especially in human dogs, hormonal and reproductive disorders, inappetence, pruritus, alopecia, reversible lightening of hair, long-term treatment, cataract, severe hepatitis. Man, inhibit mammalian P450 responsible for cholesterol, cortisol, and testosterone synthesis leading to gynecomastia. Teratogenic and embryotoxic, hence should not be given in pregnant animals. Administration: ringworm 5 to 10 mg per kg PO daily for 4-6 weeks. Systemic fungal infection in dog and cat 10 mg per kg 12 hours. Clinical application: triazole are preferred than ketoconazole, alternative to amphotericin B in the treatment of systemic mycotic infections, dimorphic fungi, candidiasis, cryptococcosis in immunocomponents animal. can be used along with amphotericin B or 5-flucytosine to potentiate its antifungal activity. Systemic treatment of Malassezia infection, soft tissue sporotrichosis in human. Griseofulvin is preferred over ketoconazole in treatment of ringworm. Activity against Aspergillus is questionable. Itraconazole, itraconazole, most potent azole, pharmacological properties similar to ketoconazole, but wider range of antifungal activity and less toxicity. Broad spectrum, including Aspergillus, available for PO and IV administration. Horse, cryptomycosis, mycotic rhinitis, inliconazole, guttural pouch mycosis, fluconazole, fluconazole inhibit lanosterol 14A dimethylase which prevent the formation of ergosterol, squalene, lanosterol, gymosterol, ergosterol. Water-soluble, weakly protein-bound, well-distributed, useful in treatment of yeast infections in CSF. With amphotericin B, oral and systemic treatment of candidiasis in human. Cryptococcal meningitis in ants, patient, dog, Candida, coccidioides, Cryptococcus, limited efficiency against blastomycosis, aspergillosis. Voriconazole, voriconazole, second generation triazole. Very broad spectrum available in oral and IV formulation, extensively metabolized in liver, high volume of distribution and excellent tissue penetration. Dose related visual distribution in 20 to 40% of the human patient. Effective in invasive aspergillosis, fusarium and flu-resistant candida infections. Animal studies are limited. Flucytosine or 5-fluorocytosine, flucytosine or 5-fluorocytosine, synthetic narrow-spectrum fungi-static drug active against some strain of Cryptococcus candida aspergillus, chromoblastomyces species, other fungi causing systemic mycosis, dermatomycosis, and bacteria are insensitive. It is a pyrimidine anti-metabolite and inactive as such. Converted to anti-metabolite 5-fluorouracil 5-FU by cytosine deaminase in the fungal but not in mammalian cell. 5-FU inhibit thymidylate synthesis and thus DNA synthesis. Mammalian cells are not affected due to very limited ability to convert flucytosine to 5-FU, rapidly absorbed and distributed in body and has excellent penetration to tissue and fluid including CSF. Main indication cryptococcal meningitis in combination with amphotericin B, candidiasis, aspergillosis and thrombomycosis. Less toxic than amphotericin B. Toxicity well tolerated. Occasional side effects: reversible anorexia, nausea, vomiting, diarrhea, mild elevation of liver enzyme, and bone marrow depression, leukopenia. Reversible: skin eruption characterized by depigmentation followed by ulceration, exudation, crust formation. Topical antifungal agent: griseofulvin, short penicillium, griseofulvin, benzofuran, cyclohexane antibiotic, poorly soluble in water, narrow spectrum, fungi-static, active against most dermatophytes and administered orally for treatment of ringworm in dog and cat, calves, horse, and other domestic animals, along with a topical antifungal agent. Ineffective against candida and other fungi, cause systemic mycosis and bacteria. High dietary fat intake promotes absorption of glycofulvin from GIT. MOA Fungicides inhibit mitosis by interfering with the polymerization of microtubules protein and disorganize the spindle microtubules. Also affect cytoplasmic microtubules. Antifungal activity all dermatophytes. PK. Absorption after oral administration depends on particle size, enhanced by high fat meal metabolized in the liver and eliminated in the feces. Deposit in the newly formed keratin of hair, nail and skin and gradually move to the site of infection in the superficial keratinized epithelium where keratinized cells mature and are progressively desquamated. Actively growing fungus are killed whereas dormant cells are only inhibited so that cure occurs only when infected keratinized cells are shed. Hence, treatment is prolonged. Toxicity. Toxicity. Prolonged medication, mild and transient side effects such as mild CNS effect, photosensitivity, GI disturbance, teratogenic. Dog and cat vomit if given in empty stomach. Administration treatment should continue 1 or 2 weeks beyond clinical or mycological cure. Single daily dose of 50 mg per kg reduced to 25 mg per kg once clinical response occurs. Ringworm infected cattle as 10% mycelium mixture 7.2 to 10 mg per kg for 1-3 weeks. Clinical application dermatophytic infection ringworm PO 3 to 6 weeks in dogs and cats. A large number of antifungals are also applied topically on skin in the ear or eye or on the mucous membrane to control superficial or local fungal infections. Locally active antifungal drugs are used to treat topical infection. The antifungal agents are iodine preparation, iodophore, tincture iodine, potassium iodide, copper preparation, CVSO4, cuprimycin, phenol, thymol, hexachlorophenol, hexachlorophane, fatty acid and salt, propionate and undesylanates, organic acid, benzoic acid, salicylic acid, dye, gentian violet, carbofucin, hydroxyquinones, chlorhydroxyquinone, nitrofurans, imidazole, miconazole, clotrimazole, thiabendazole, Pauline antibiotic, amphotericin B, nystatin, natamycin, miscellaneous tolna, miscellaneous tolnaflates, haloprogrin, dichlorophene, and monosulfame, benzoic acid, bacteriostatic and fungistatic organic acid used as food preservative. Thus, this is effective against trichophyton infection in cattle and men. Salicylic acid. Salicylic acid, antipyretic agent. It is having keratolytic and some fungistatic effect. It softens the crust and act on the organism thus exposed. It is suitable for topical ringworm infection used as whitefield ointment. Whitefield ointment antifungal salicylic acid plus benzoic acid 3%. Undecylenic acid undecylenic acid used as 10% powder or alcoholic solution. Potent topical fungi static effective against microsporium species at higher concentration. It is an irritant, hence used in combination with zinc or copper salt to minimize the irritation. Copper is also an antifungal agent. It is ringworm fungicidal because of its astringent and causative nature. Fungal mastitis in cattle. Tolnafate Tolna, Tolna flatate, Tolna flatate, 1% lotion, active against dermatophytes, but not against candida and bacteria. Used topically with oral glycofulmin. Cyclopyroxolamine, cyclopyroxolamine, 1% lotion, broad spectrum antifungal drug, active against all dermatophytes and candida, used to treat dermatomycosis and candida infection. Haloprozine, Haloprozine, 1% cream, synthetic antifungal agent used for treatment of dermatomycosis in dogs. Candidiacean, Candidacin, fungistatic and fungicidal antibiotic, active against candida and mainly used in moniliasis, also used in dermatomycosis ringworm. Iodochlorhydroxyquinone, iodochlorhydroxyquinone, 3% cream ointment powder, both antibacterial and antifungal activity, used topically to treat mixed infection. Cuprimixin, both antifungal and broad spectrum antibacterial effect. Active magazine is released on application. Amorolfine, used to treat dermatophytosis. Terbinafine, occasionally used in dog and cat. Topically 1% cream or orally 5 mg per kg per day for 7 weeks against dermatophytosis and candida. Terbinafine, dermatophytes, Melassagia, Sporothrix, candida, dimorphic and filamentous fungi. Neptifine, topical dermatophytic infection, more effective in systemic treatment of intractable and persistent dermatophytes infection, more effective than azole and glycofulmin. MOA, inhibit squalene epoxidase, prevent the conversion of squalene to ergosterol. Squalene alters membrane permeability, cell death. Antifungal activity, dermatophyte, Aspergillus, Sporothrix, candida, Melassagia, Sporothrix, dimorphic fungi. Resistance, rare resistant development is through mutation and efflux of the drug. PK. Lipophilic, well absorbed, bind strongly to plasma protein, penetrate keratinized tissue, enter the stratum corneum and sebum by direct diffusion through the dermis and living epidermis. Stay in the skin and hair for long time. Excretion through urine 80% and feces 20%. Toxicity, well tolerated, adverse effect in GI system and skin, abnormality in liver enzyme and hematological parameters. Clinical application, high efficacy, low incidence of adverse reaction, short course, choice for dermatomycosis. Terbinafine plus triazole to treat resistant candida. Length of therapy 33 to 63 days. More active than glycofulmin against trichophyton and microsporum. Topical azole, imidazole, ketoconazole, miconazole, clotrimazole, nilconazole, itraconazole, ketoconazole, miconazole, clotrimazole, 1% cream or lotion. Clotrimazole is broad spectrum topical antifungal agent for local application in mycotic keratitis, metritis. 1% solution Aspergillus infection of cornea. Dog nasal aspergillosis intranasal treatment. Human candida vaginitis. Cow mycotic endometritis infusion of 400 to 600 mg in saline every other day for 12 a day. Yeast mastitis 100 to 20 mg per quarter per day of 1% solution, a single daily dose on 4 occasions. Miconazole 2% cream, similar to clotrimazole. Most active topical imidazole, especially for candidiasis. Topical treatment of dermatophytes, candida, aspergillus, and melasmasia. Miconazole plus chlorhexidine, some more effective than selenium sulfide for the treatment of seborrheic dermatitis in dog caused by melasmasia. Miscellaneous antifungal agent. Miscellaneous antifungal agent. Other agents, phenol, iodine, and mercurial, have antibacterial as well as antifungal activity, but they may cause damage to normal tissue. Topical antifungal agents generally containing an antibiotic, a corticosteroid, and an antihistaminic in addition to an antifungal agent. Iodides. Iodide MOA is poorly understood, probably by enhancement of the immune response of the host or by spurring the halide peroxide killing system of phagocytic cell. Amphotericin B and imidazole also affect the immune system. Sodium iodide and ketoconazole additive effect, Nature aspergillosis, ringworm, sporotrichosis. Thiabendazole. Thiabendazole useful in tropical ringworm infection when dissolved in alcohol orally as an adjuvant in the treatment of nasal aspergillosis in dogs. Monosulfirans. Monosulfiran insecticide and include in some preparation when fungicidal and miticidal activity is required. Dichlorofen, tiny acid and fungicidal available as 2% ointment or alcoholic solution. Effective against trichophyton and microsporum. It is also bactericidal. Dicarbolfuran applied topical twice a day for 7 days. Gentian violet. Gentian violet used in candidiasis. Echinocandins or pneumocandins. Echinocandins and or pneumocandins. Echinocandins are novel lipopeptide antifungal agents which are B13 glucan synthesis inhibitor preventing formation of B13 glucan polypeptide in the cell wall. Caspofungins, first commercially available micafungin anti and anindalafungin MOA. Cell wall of fungi is made up of glucosamine polymer and chitin, a layer of mannan protein heavily glycosylated at the outside, a layer of 1,3-glucan and B16-glucan, and a layer of chitin. Echinocandins inhibit the formation of fungal cell wall. They inhibit the synthesis of an important component of the fungal cell wall, a glucose polymer beta-glucan, because of which the fungal cell lysis occurs. Spectrum. Spectrum active against candidiasis and aspergillus species, including isolated resistant to azoles and amphotericin B. Highly active against aspergillus species, active against pneumocytosis carni, limited C. neoformans, B. dermatitis, fusarium, and B. C. hematitis. PK only IV as they are not absorbed orally. Caspofungins elimination urine and feces are metabolite. Toxicity phlebitis as infusion site, fever, nausea, well tolerated. Clinical application, invasive aspergillosis, unresponsive to other. Candidiasis, similar efficacy like amphotericin B or fluconazole. Thank you.